Welcome back, everyone. We're going to continue the toxicology series with taking a look at ethanol and methanol. Alcohol is the most widely abused drug in the United States. Warning signs that include alcohol abuse or indicate alcohol abuse is consuming large quantities or over a long period of time, spending a considerable amount of time obtaining, using, and recovering from alcohol use. The patient may be experiencing social problems, reduced social, occupational, and recreational activities. As far as pathophysiology or physiologic presentation for alcohol abuse, dependence on alcohol involves drinking to function normally and feel good. Alcohol acts as a depressant within the frontal lobe and can alter decision-making and or decrease a person's inhibitions. Psychological and physical dependence can escalate over time and with extended period of use, and a person with alcoholism is more prone to serious illnesses and injuries. Acute alcohol intoxication. So for treatment for someone who is exhibiting signs of acute intoxication, airway management is going to be important. Have suction available. We can provide supplemental O2 if the patient is hypoxic. The biggest complication to that will be respiratory depression in the obtunded patient that's not really ventilating adequately, in which case we may need to assist ventilations and provide oxygenation. And for advanced level providers, establishing IV access and administering fluid bolus can help, as there are some diuretic effects associated with alcohol. Paramedics should be assessing ECG rhythms, and you should be assessing blood glucose levels. To prevent complications like Wernicke's encephalopathy, if you have thiamine available to you, you should be administering thiamine before administering glucose for these patients. And it may be helpful to administer thiamine in general to the chronic alcohol users. Oftentimes, malnutrition can be present in this population as well. Complications with alcohol cessation. So patients can experience withdrawal seizures within the first 12 to 48 hours of their last drink. We're going to use the same care for these patients as we would with alcohol intoxication, and we may need to consider the use of benzos for seizure management for paramedic level providers. Delirium tremens usually starts within 48 to 82 hours after the last drink. These signs can be a bit more intense for the patient and typically include things like tremors, restlessness, fever, tachycardia, hypotension secondary to dehydration, along with tremors and confusion. Try to keep the patient calm if they're experiencing delirium tremens. Maintain personal safety. If the patient is combative and you are of adequate certification level and have protocols in place to consider chemical restraint, this may be a good patient. Administer supplemental oxygen via nasal cannula if the patient presents with signs of hypoxia. And again, dehydration can be a complicating factor here, so we may need to consider fluid boluses and IV access if your certification allows. Methyl alcohol can be found among house products. Things like formaldehyde or formic acid are responsible for methanol poisoning. Peak levels in the blood are typically attained within the first 90 or so minutes. These are usually accidental or intentional ingestions, and poison control is a great resource here. I know we've talked about this in the overview a little bit. When a patient consumes chemicals at home and you're not really sure what the best treatment modality is, reach out to poison control. They can serve as a great resource for you, and also let the facility that you're transporting to know so that they can be prepared with the appropriate interventions or antidotes if you don't have access to them. Symptoms typically appear within 12 to 18 hours after ingestion and includes things like nausea, vomiting, headache and vertigo, abdominal pain, and blurred vision or blindness. You may find the patient presenting with altered mental status, dilated pupils, hypotension, and tachypnea are also common. Airway management and supportive care at the airway, breathing, and circulation level are always warranted. Assess blood glucose levels, and you may consider alkalinizing agents such as sodium bicarbonate. Again, I would consult online med control and poison control prior to administering sodium bicarb. We just want to make sure that the risks don't outweigh the benefits here for these patients. And activated charcoal, for my EMT friends out there, is contraindicated for methanol or alcohol use. Ethylene glycol is a colorless, odorless liquid, and lethal dose is very minimal at 2 milliliters per kilogram or as little as 150 milliliters. It is water soluble, and the liver and kidneys metabolize this into toxic metabolites. So while ethylene glycol is not toxic directly, the metabolites that are created from the liver and kidney create metabolic acidosis, and these patients can be profoundly acidotic and can be lethal. Stage 1 occurs soon after ingestion. You'll start to see CNS depression and an intoxicated appearance. This may accompany things like nausea, vomiting, seizures, and then coma. Within 12 to 24 hours, you'll start to see cardiopulmonary symptoms and possible hypocalcemia. And then you'll start to see permanent irreversible renal damage within 24 to 72 hours. Care is the same for methanol poisoning, and you may be ordered to administer calcium gluconate from online med control, and watch carefully for cardiac dysfunctions related to the metabolic acidosis that arises from this patient.